Gallbladder cancer is one of the most common hepatobiliary pancreatic cancers we see in India. Because its symptoms are often vague and similar to gallstone disease, it is frequently diagnosed late. In this video, I'll walk you through how gallbladder cancer is detected, the imaging tests that we use, and the treatment options available from surgery to chemotherapy and beyond. Hello, I'm Dr. Kaival, a GI and HPB surgical oncologist. I specialize in cancers of the pancreas, liver, bile ducts, and gallbladder. Today, we'll take a detailed look at gallbladder cancer, starting from imaging for diagnosis to treatment strategies, depending on the stage of the disease. My goal is to explain this in plain language, so patients and families can feel informed and supported. The gallbladder sits tucked under the liver and is often removed for gallstones. Sometimes, cancer is only discovered after surgery for stones, when the pathology report shows malignant cells. In other cases, patients present with vague abdominal pain, jaundice, or weight loss. The challenge is that by the time symptoms appear, the disease is often advanced. To evaluate gallbladder cancer, we use a series of imaging tests. First, ultrasound, often the first test which may show a mass, polyp, or a gallbladder wall thickening. A CT scan, it gives detailed information about the tumor, its spread to the liver, and the surrounding lymph nodes. MRI with MRCP provides excellent detail of the bile ducts and liver involvement. A PET scan is used to look for spread to distant organs, also called metastases. These scans help us stage the cancer and decide if surgery is possible. For patients with early stage gallbladder cancer, surgery is the main curative option. The extent of surgery depends on the stage. For very early cancer, that is stage T1A, removing the gallbladder may be enough. For more advanced early stages, T1B, T2, and some T3, we perform a radical cholecystectomy, which means removing the gallbladder along with part of the liver, that is segments 4B and 5, and nearby lymph nodes. If the bile duct is involved, part of it may also be removed and reconstructed. These surgeries are highly specialized and should be performed in HPB centers. Between the clearly operable and clearly inoperable cases, there is an intermediate group of patients. For example, some T3 or T4 tumors or patients with lymph node involvement. In these situations, we often use neoadjuvant chemotherapy first. The aim is to shrink the tumor, control microscopic disease, and then reassess with imaging. If the cancer responds, well, surgery might become possible. This approach gives more patients a chance at potentially curative surgery, even when things look difficult at the start. If the cancer has spread too far to remove completely, we focus on palliative treatments. Biliary stenting or bypass is done to relieve jaundice, chemotherapy to control disease and improve survival. The standard drugs are gemcitabine and cisplatin. Targeted therapy and immunotherapy, including newer drugs such as durvalumab, have shown promising results in advanced biliary tract cancers. The aim here is not cure, but improving quality and the length of life. Deciding treatment for gallbladder cancer is never a one-doctor decision. At a tumor board, surgeons, oncologists, radiologists, and pathologists come together to plan the best strategy. This ensures that every option is considered, from surgery to systemic therapies. Outcomes in gallbladder cancer depend heavily on the stage at diagnosis. Early stage disease treated with surgery offers the best survival. That's why awareness, regular follow-up for gallbladder polyps, and timely surgery for high-risk gallbladder conditions are so important. To summarize, gallbladder cancer is often difficult to detect early, but with modern imaging and careful staging, we can identify which patients benefit from surgery, which may benefit from neoadjuvant treatment before surgery, and which need systematic or supportive care. If you or a loved one is facing gallbladder cancer, seek care at a specialized HPB center where a multidisciplinary team can guide you. If this video helped clarify the journey from diagnosis to treatment, please share it so others can also benefit. Don't forget to like, subscribe, and follow for more clear explanations of pancreatic, liver, and bile duct cancers.